I call them vacation shots. They are perfect when you've got a big trip or a wedding or a special event and you need that short-term relief to get you over the hump. They were marketed as lubricants for your joints. WD-40 for your knees. It was going to be perfect. I was hopeful too, honestly. But in real life, they're only mildly effective and they're very expensive. PRP, it's your own blood, concentrated down and put back into your knee. It's the closest thing we have to a natural healing injection. Every single one of them told him the same thing. We can regrow your cartilage. We had a blast. We didn't hit anything, but we were definitely flying blind. 90% of the knee braces you'll find at Amazon are not what most people with arthritis actually need. Unfortunately, there is no injection on earth that replaces the work that we talked about in the first 4 episodes. Most people don't lose their health all at once. It happens slowly, quietly, through a system that was never designed to catch it early. I'm Dr. Darin Allred, and I've spent over 20 years as an orthopedic surgeon watching metabolic disease show up in my operating room long before anyone gave it a name. This channel exists because that needs to change. Every video here is built on one belief. You deserve to understand what's actually going on inside your body. Let's get into it. A patient came to see me a few months ago with pain on the inside of his knee, not the outside, but the inside. His MRI showed moderate arthritis, not the worst I'd ever seen, but enough to slow him down. Before I ever walked into my office, he had done a ton of research. He looked into stem cell clinics in Mexico, he looked into clinics in the Caribbean. He'd even called a few places here in the US. Every single one of them told him the same thing. Yeah, we can regrow your cartilage. He knew that the procedure wasn't FDA approved in the United States, and he also knew that US clinics would offer it anyway. He compared prices, read testimonials, watched the YouTube videos, all with smiling patients walking out pain-free. By the time he had sat down across from me, he had one question. Doc, is it true? Can stem cells actually regrow my cartilage? Here's what I told him, and I said the honest answer is, we don't know yet. And anyone who tells you that they do know is either not reading the research or they're trying to sell you something. Some studies admittedly show great results. Others show no real difference, and most patients, they do get temporary pain relief. They don't get that permanent cartilage regrowth. The FDA technically hasn't approved any of the stem cell products for arthritis in the United States. Many clinics do offer it, however, and like many of the things that we do with the FDA, the physicians frequently use things that are not FDA approved. So I don't know that that's a huge red flag, but just know that there's definitely some friction there. My patient sat there for a minute and then he said something I hear a lot, but the testimonials, they look so real. And yes, I felt bad for them. They are real. Those patients did feel better. And the question is why? Was it the stem cells? Was it the PRP? Was it the anti-inflammatory effect of the injection itself? Was it the placebo effect? Which in pain is one of the most powerful forces in medicine. You just can't tell, and that's part of the problem. I didn't tell him not to do it. I want to be very clear here because definitely some studies show it work. I just told him to understand what he was buying. He was buying a chance, not a guarantee. And I told him there are things that we can do right now, things that would help today while the science on stem cells catches up. That conversation is what this entire episode is about, because stem cells aren't the only treatment in the interventional space where hope runs ahead of the evidence. There's a whole landscape of injections, peptides, and devices out there, some that work, some that don't, and some that are still too early to call. And if you're going to spend your own money and put your trust in any of them, you at least deserve to know the truth. So let's walk through it. I'm Dr. Darin Allred. I'm a board-certified orthopedic surgeon, and this is the Arthritis Deep Dive, a 6-part series on what knee arthritis really is, what's actually driving your pain, and what you can do about it without ending up in my OR. If you've been following along, we've covered a lot of ground. Episode 1 was about the truth regarding knee arthritis, why x-rays don't tell you what you think they do. Episode 2 was about GLP-1 medications and the biggest surprise of my entire career. Episode 3 was about movement, the most underused medicine in orthopedics. Episode 4 was about what you put into your body, the food, supplements, medications, and the weight from the food decisions you make in life. Today is the interventional episode, the needles, the injections, the peptides, the braces, and this is a space where there's the most confusion, honestly. There's the most marketing and the most money being spent on things that range generally helpful to completely unproven. I'm going to walk you through each one and hopefully tell you what works and what doesn't, what's worth trying, what's a waste of your time and money. And by the end of this episode, you'll know more about these treatments than most patients who've already had them. Let's start with the one most people know. That's cortisone, otherwise known as steroid injections. Your doctor might have called them cortisone injections. They work, and they work very fast. Within a few days of a steroid injection, most patients feel a significant drop in their pain and swelling. That inflammation inside their joint quiets down, and you can move better, you can sleep better, and for a lot of people, it feels like a miracle. But here's what I tell patients before I pick up the needle. This is temporary. Yes, some patients get longer relief, but on average, if you take everybody, most only get about 3 months of pain relief. Yes, I've had patients that have lasted 2 or 3 years, but on average, it's about 3 months of pain relief. And in general, it keeps working less and less with time. I call them vacation shots. They're perfect when you're going on a long trip, you have a wedding or a special event, you need short-term pain relief just to get over that hump. And used that way, they're one of the best tools that we have. But they're not designed to be a long-term strategy, and here's why. Too many steroid injections can actually damage your cartilage over that time. That same drug that's reducing your inflammation is also at higher repeated doses breaking down the tissue that you're trying to protect. So because of that, I actually limit patients to about 3 injections in one knee, and that's usually spaced more than 3 months apart. If your cartilage is still relatively healthy and you're young, I rarely recommend them at all because you're trading that short-term pain relief for a potential long-term harm. Now let's be honest, the risks of these injections are low. We've been giving them for years and years and years, or for decades, I should say. Infections are rare, and the main side effects are a temporary bump in your blood sugar, and especially if you have diabetes, you have to be very careful. And sometimes you feel a little bit emotional afterwards. Nothing dangerous for most people, but the cumulative effect on cartilage, it is real, and it's the reason I use these sparingly and strategically. Honestly, the more I learn about the metabolic side of arthritis, I'm using injections less and less. Bottom line, steroid injections, they're a tool, yes. They are not a treatment plan. They buy you time. What you do with that time, it actually matters. Now let's talk about hyaluronic steroid injections. You may know them as chicken comb injections or the brand names of Synvisc, Euflexa, Orthovis, Supartz, or Hyaluronic. These were all the rage for years, and they were marketed as quote-unquote lubricants for your joints, WD-40 for your knees, and I was hopeful too. I was in residency when they were introduced. They were great, but over the years, I don't know. The idea makes intuitive sense. Your arthritic knee has lost some of that natural lubricating fluid that keeps things moving smoothly, so we inject a synthetic version of that fluid, hyaluronic acid, directly into the joint to restore the cushion. And it sounds great on paper. It's made up of substrates of what your real cartilage is made of, but in real life use, they're only mildly effective and very expensive, and the large independent studies, the ones not funded by the companies selling the product, found that the benefit is small, inconsistent, and often doesn't exceed what you get from a placebo injection. The American Academy of Orthopedic Surgeons reviewed all the evidence and found insufficient evidence to recommend them. It certainly fits my clinical practice. Honestly, I've quit using them altogether. Just not worth the money for patients. And I've had so many patients come back and complain that it didn't work, that I just simply don't use them anymore. I think insurance companies have caught on to this, and that's why most of them no longer cover them. Medicare still does, but if you don't have Medicare, you're going to have to pay cash for them. While a few patients do report mild pain relief, most don't notice a big difference, and that placebo effect in injection studies is substantial. The ritual of going to the doctor, getting a needle, and believing something is being fixed, that alone can produce a real measurable pain relief. And when you're paying out of pocket for that treatment, you just need to know what you're buying. My usual advice, save your money. If you're going to spend cash on an injection, there are really better options. This brings us to PRP, platelet-rich plasma. This is the one I'm most optimistic about, and here's how it works. We draw a small amount of blood from your body, just like a routine blood draw, and that blood goes into a centrifuge, a device that spins it down and separates into layers. And we take the platelet-rich portion, the layer that's packed with natural growth factors and healing signals, and we take that and re-inject it back into your knee. We're not putting a foreign substance into your body, and you're concentrating your own biology and putting it exactly where it needs to go. The research on PRP for mild to moderate, not severe, arthritis is strong, and it's honestly getting stronger the more we know about it. Recent meta-analysis, these are studies that combine the results of many trials together, so that PRP does in fact produce clinically significant improvements in both pain and function compared to placebo and compared to hyaluronic acid. The effects last typically somewhere between 3 and 12 months. And here's where it breaks down for me, the caveats. PRP, it does not work well for advanced arthritis, that kind where you're truly bone on bone with very little cartilage. It works best for that mild to moderate disease where there's still a little bit of cartilage to protect an anti-inflammatory environment to calm down. Here's the problem. Again, it's not covered by insurance and you're going to pay cash for that. Typically somewhere between $600 to $1,000 where you're, depending on where you are in the country. And the results can vary depending on how the PRP is prepared. Research suggests that leukocyte-poor preparations with a higher platelet concentration, sometimes we call that a higher cell count, tend to work best. So if you pursue this, make sure you're going to a provider that understands those details. If you can't afford it, PRP it's a good short-term natural option that lasts 6 to 12 months. It's the injection that I recommend the most for the right patient, but let me be clear, it's only providing temporary pain relief. It's not, and I'll say that again, it's not regrowing cartilage. It's calming that fire inside your joint and it's just not rebuilding the house. So I usually tell patients it depends. If you think it's worth the $600 for several months pain relief, then it may be a good option for you. Now, let's come back to my patient, the one who called the clinics in Mexico and the Caribbean before he ever walked into my office. Stem cell therapy for knee arthritis, it is exciting and I am excited about it, but I want it to work and the idea is compelling to take cells that have the potential to become cartilage and inject them into a damaged joint and let the biology do the repair work. If it worked reliably, I would change everything. Right now, that science is mixed, unfortunately. Some studies show great results. Others show very little difference compared to PRP. And one study that I quote frequently actually showed that PRP outperform stem cells at a fraction of the price. Most patients who get stem cell injections do get temporary pain relief. 6 to 12 months is typically what I quote. But what we're not seeing consistently is permanent cartilage regrowth on MRI. Also, there are so many versions of stem cell therapy, and they're definitely not all the same. Some use cells from your own bone marrow, some use cells from your own fat tissue, some use cells from umbilical cords. Some clinics in Mexico and the Caribbean are using preparations that aren't legal in the United States, and invariably the cell source preparation methods, cell viability, and dosing make it all very hard to compare results across studies or across clinics. The biggest problem is cost for sure. Stem cell treatments can run in thousands of dollars. Most of my patients that have had it done, $5,000 or $6,000. I've heard patients getting $10,000 quotes, and insurance does not cover it. For that kind of money, you really need to know what you're getting. And right now, what you're getting is a chance and not enough of a certainty in my mind to risk the $1,000 price tag. Now, certainly, if you have what I typically describe to patients, if you have an extra $5,000 to take that chance, I think it's a great option and it does make sense, but I don't want to sell you something without you understanding completely what's involved with it and completely the risk. And my advice is if you're curious, if you have the cash and you want to explore it, go in with eyes wide open. Understand that you may get temporary pain relief similar to PRP, and understand that permanent cartilage regeneration is definitely not proven at this point. Understand that the proven strategies, movement, weight loss, nutrition, and other tools we've covered in this series are still doing the heavy lifting. I would much rather see you spend your time and money doing those things than flying to the Caribbean. We all love a trip to the Caribbean. I wish I could recommend stem cells more confidently. I think we'll get there, but they're just not there yet. Now let's talk about something that's absolutely exploded in popularity over the last few years, and that's peptides. At least one person per day asks me what I think about peptides for knee pain, and I suspect millions of patients are taking these medications right now. In the current landscape, in May 2026, they don't require a prescription. Because they don't require prescriptions, patients are ordering them online through the gray market, and we'll get to that later, but that is one of my main concerns with them. They've been advocated by tons of social media influencers. Here's a problem. We only have a handful of human studies on many of them and 0 studies on some of them. Even though we don't have many reported complications, it's hard to know for sure without more research. I've done a ton of research on these and I'm very excited about them. But I also think there are some very important things that I think you need to know. And during this discussion, we're just going to touch on the general concepts and we won't go into significant detail. Let me tell you a story from my own life that explains kind of how I think about these. One day, I was invited to go wake surfing at night. I'd never done it before, and I wasn't particularly crazy about the idea, but I decided to go anyways, and it was fun. It was exhilarating, it was refreshing, it was beautiful. Was it safe? Ooh, I don't know. We really couldn't see that far in front of us. There's stuff underneath the water that we couldn't see, but sure, we had a blast and we didn't hit anything, and I've had multiple friends go, and it was safe for them, but was it safe? I don't know. I'll let you decide. Peptides feel that way to me. I don't see problems ahead, but since we have very few human studies, I cannot say whether they're safe or if they even work at all. What we do know is that most of the peptides are accompanied with thousands of success stories online, and we're not hearing very many stories about complications. Is that due to the placebo effect? Is that due to the lack of studies? And as we accumulate studies, will we find that they are unsafe? I don't know. The three peptides most commonly discussed for joint health are BPC-157, TB-500, and GHK-Cu, and that's copper. You'll hear that referred to as the copper peptide. BPC is one of the most studied healing peptides in the regenerative medicine space. Animal studies suggest it may accelerate healing in soft tissue injuries, improve blood flow, decrease inflammatory cytokines, and reduce joint pain and swelling. The evidence is preliminary, but intriguing for sure. However, most of this work has been done in animals and not humans, and there's really only one human study that I'm aware of, and that actually is in knee arthritis. And it did show success in the study, but it's not a good quality study, and the patients injected the peptide directly into the joint, and I do not recommend that at all. I highly recommend against this. If you get a joint injection, you may never be able to replace that joint if you need it, and it can be a catastrophic event, and it definitely burns a bridge. So do not inject it into the joint directly. TB-500 is thought to work synergistically with BPC-157 and purported to help cells migrate to the injury and create new blood formation and encourage connective tissue regrowth. Athletes recovering from injuries often improve mobility and improved post-exercise pain. Most of those are anecdotal, however. Copper peptide, it's a naturally occurring copper binding peptide found in human plasma and appears to play a role in wound healing, immune regulation, and tissue remodeling. Early orthopedic research suggests it may help modulate inflammation inside joints, and though this application needs much more study. By the way, when I talk about peptides, I refer to all of the peptides excluding the GLP-1s. They're technically peptides as well, but as we've discussed, there is a ton of data on GLP-1s, and this conversation completely excludes those in our conversation. My stance is this. Peptides, they're biologically plausible. They're mechanistically interesting, and they very well may play a role in future arthritis care. However, they should not replace proven strategies like weight loss, GLP-1s, movement, and inflammation control through your diet. One quick comment. At the time of this recording, most of the peptides are still only available on the gray market. This means it's almost impossible to verify where they come from and if they're safe. You have, unfortunately, no way to verify if they're from a sterile facility or if they're sterile or if they have contaminants in them. And since you inject them directly in your body, it's harder for your body to deal with any issues because you bypass most of your body's protective mechanisms, mainly your skin or GI tract. In short, I can't in good conscience recommend these currently. My recommendation is you wait until you can purchase them from a compounding pharmacy where at least we have better oversight. I anticipate this will be in the fall of 2026, and we won't have a ton of clinical data at that point, but you'll at least have more comfort in the safety of the actual source of the peptide itself. The future of arthritis may well include peptides, but we're still writing that chapter, and it's way too early to know how it ends. And in the meantime, be careful and do a lot of research on the manufacturer and the peptides before you purchase. Let me shift away from needles and over to hardware for a minute, because bracing is one of the most misunderstood tools in knee arthritis. Walk into a pharmacy or click on Amazon and you'll see hundreds of knee braces. Unfortunately, 90% of them are not what most people need with arthritis. Most over-the-counter knee braces are neoprene sleeves or simple stabilizers, and they may feel snug and warm and comforting, but studies consistently show no meaningful reduction in pain or walking improvement. And they definitely don't slow disease progression in knee arthritis. So think of that soft sleeve like a placebo with padding. It makes you feel supported, but it doesn't change the physics of your knee. Now, here's the good news. They're cheap, they're safe, safe, they're easy to try. Tell patients to experiment with them to see. Maybe it helps, and if it helps, great. There's no real downside to using them. Now, there is one brace that can truly help with arthritis pain, and that's called an unloader brace. It's also called an offloader brace, and this works on a completely different principle. Most patients with arthritis have more wear on the inside or medial compartment of their knee. When that inner compartment collapses, your knee starts to become more bow-legged if you have medial arthritis. So an unloader brace gently pushes the knee outward, and it takes pressure off the damaged inside of your knee, transferring it to the healthier outside of your knee. In mechanical terms, it moves your leg's plumb line, that's the center of force, towards the healthy side, so damaged cartilage bears less weight with each step, and it moves it towards the good cartilage. That change can dramatically reduce your pain in the right person. Here's the problem with that, and here's the key. You really, number one, must know which side your arthritis is on. Is it medial or is it lateral before you buy that brace? If you buy the wrong unloader brace, you're going to offload the pressure on the good side and make it go to the bad side, and obviously that's exactly what we don't want to do. Your provider can help you figure that out, and really need an x-ray to figure that out. One more thing about bracing is if you have tri-compartment arthritis. Tri means that you have arthritis in all three components, or you have it both on the inside and the outside. The bracing really doesn't work that well. You really need one good compartment to transfer that weight to. Another thing is if you have a lot of soft tissue, if you're heavier than you'd like, the brace is just physically not able to push on your femur to offload the weight. People with really thin legs tend to fit the brace better and have better success with the braces. You can get these offloader braces on Amazon, and they're about $150 to $300, or you can get them fitted through an orthopedic brace specialist, and unfortunately they're much more expensive and often $1,000 to $3,000. Many of my patients choose the Amazon option, and that's totally fine, but just make sure that that fit is correct. A poor fitting unloader brace is an expensive piece that does nothing. Let me step back and give you a frame that ties all this together. Every single treatment we've talked about today, steroid injections, hyaluronic acid, PRP, stem cells, peptides, braces, they are all tools. Some of them are great tools. Some of them are completely unproven tools. And a few of them are tools I wouldn't spend my money on personally. But none of them, not a single one, is a solution by itself. If I inject PRP into your knee and you go home and sit on the couch and eat the same food, carry the same weight, and avoid the same exercises, that injection is going to wear off and you're going to be right back where you started. The thing you need to understand is that injection, it buys you a window. What you do with that window determines whether you're actually going to get better or not. The real treatment for knee pain arthritis hasn't changed across these 5 episodes. Move your body, build your muscle, eat in a way that lowers inflammation, and manage your weight. Sometimes that involves using medications, and GLP-1 medications can not only reduce the inflammation, but help you manage the weight as well. Those injections help you temporarily, but they don't replace the core treatment. There's no injection on earth that replaces the work that we talked about in the first 4 episodes, unfortunately. But the right injection at the right time for the right patient can make that work a lot easier. That's the truth about needles. That's the truth about peptides. That's the truth about braces. And that's the truth I told my patient when I sat across from him in the clinic that day. When my patient asked me, can stem cells regrow my cartilage? He wasn't being naive, he was being hopeful. And that hope is definitely not a bad thing. Hope is what got him into my office in the first place. Hope is what kept him researching, calling clinics, comparing options. Hope is the reason anyone tries anything new. But hope without information is just a coin flip. And when the coin costs $5,000 to $10,000, and the answer might be maybe not yet, you deserve to know before you flip it. What I told him that day is what I'm telling you right now. The interventional space is evolving fast. PRP is helpful for the right patient. Stem cells may get there some days, but are expensive. Peptides are very, very intriguing and interesting, but are not accompanying with a lot of data. Steroid injections are useful in small doses, and the right brace, fitted correctly, can take meaningful pressure off the damaged joint. But the foundation, the thing that actually changes the trajectory of your arthritis, is still what you do every day. How you move, what you eat, how you take care of the body that carries you. The next episode is our final episode, and we're going to talk about surgery, when it's actually the right choice, what to expect, and how everything we've covered in this series fits together into a plan that either keeps you off the operating table or least get you the best outcome if you have to be on that table. If this episode saved you from spending money on something that you wouldn't, if this episode saved you from spending money or pointed you in a direction, if this episode saved you from spending money on something that you wouldn't have, this episode saved you spending money on something that wouldn't have helped or pointed you towards something that will, do me a favor, send it to someone you know has been Googling stem cell clinics at 1 or 2 in the morning, and that's the person that needs this the most. I'm Dr. Darin Allred. Thanks for watching. I'll see you in episode 6.